There is a lot of hues and cry over the existence or perceived nearness of coronavirus in or around Nigeria. Before we start discussing this topic, let's go through what coronaviruses are. Coronaviruses are a large family of viruses that cause illness, ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome, MERS, and severe acute respiratory syndrome, SARS. A novel coronavirus is a new strain that has not been previously identified in humans. Coronaviruses are zoonotic. By that I mean they are transmitted between animals and people. Detailed investigations found that severe acute respiratory syndrome was transmitted from civet cats to humans and MERS from dromedary camels to humans. Several known coronaviruses are circulating in animals that have not yet infected humans. Common signs of infection include respiratory symptoms, fever, cough, shortness of breath, and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Standard recommendations to prevent infection spread include regular hand washing, covering mouth and nose when coughing and sneezing, thoroughly cooking meat and eggs. Avoid close contact with anyone showing symptoms of respiratory illness, such as coughing and sneezing. On February 11, 2020, Professor Akin Abayomi, that's the Lagos State Commissioner for Health, dismissed the claim on his Twitter handle. He wrote, "This is absolute falsehood. Nigerians and the international community should disregard this report intentionally published to cause panic and anxiety among our people. We reiterate our disrelish for fake news, and it remains a criminal offense." All right. The Nigerian Center for Disease Control, NCDC, has also dispelled rumor of importation of the deadly coronavirus to Nigeria. In a statement, NCDC noted that the individual in question returned from China recently and went for a routine medical test as requested by his employers. According to the center, the unnamed individual showed no symptoms of illness and has not been diagnosed with the coronavirus. Noted that NCDC agreed on a national case definition to identify suspected cases and establish a laboratory testing platform to test samples from patients who met case definition. He urged Nigerians to disregard the rumor and discourage it from further spreading, as NCDC, Port Health Services, and state epidemiologists are aware of the processes for case identification and confirmation and will investigate every suspected case to ensure that Nigerians are safe. NCDC advised travelers from China to Nigeria in the last few days to report immediately to the center through its communication center. Now, in all of this, what is the China's ambassador to Nigeria, Zhou Pingjian, saying? Before we hear him, let me tell you outright that his own belief is that most countries are overreacting by repatriating their nationals.
All the responses to the epidemic should be based on science instead of fear. It is understandable that some countries have taken necessary and appropriate prevention measures, but we disapprove of measures out of proportion. As WHO insists, there is no pandemic yet, and there is no reason for measures that unnecessarily interfere with international travel and trade. WHO does not recommend and actually oppose limiting trade and movement.
The director, Center for China Studies, Charles Onunaju, says there is a level of commitment to protect all foreign nationals in China.
Special measures have been taken to protect all foreign nationals in China, including Nigeria. And so far, nobody within the Nigerian community has been adversely affected. And what we have listened from His Excellency is the steep decline, both in the infection and more importantly, the fall in death rate, and the treatment and discharge of many people who were infected. So we saw a clear demonstration of the will, the strength, and character of the Chinese Communist Party and the government of People's Republic of China, that its commitment to build an inclusive world of shared future and destiny for all humanity is real and genuine.
Viewing Nigeria and China as friends, the director of contemporary China-Africa research says a friend in need is a friend indeed. We should assist China in all ways.
A friend in need is a friend indeed. So I'm speaking to our future African and Nigerian leaders that no matter how poor you are, and the money needed by the World Health Organization, which is 675 million, to contain the spread of coronavirus, not only in China and other poor, weaker nations, 675 million could be stolen in one state in Nigeria at a blow. So what are we doing? We should also tender a hands of support and donations, not only sending solidarity messages vocally and just talking. Please, Nigeria and Africa, do something for our friend China.
On this program, we are looking at coronaviruses and Nigeria. We want to know from the China's ambassador if there are plans to develop a vaccine.
The prevention and control of the COVID-19 outbreak is a top priority of the Chinese government. In the WHO now has an official name for the coronavirus, COVID-19. Coronavirus disease, first found in 2019, COVID-19. China has leveraged its institutional strengths and started an all-out nationwide people's war against this epidemic. The government has taken the most thorough and rigorous measures, many of which have far exceeded the WHO and what the WHO and international health regulations require. At the meeting of the Standing Committee of the Political Bureau of the CPC Central Committee, the epidemic control and prevention are now at their toughest and most critical period, and the country must spare no efforts to continue with key tasks against the contagion.
From Africa China Media Center comes Okonna Emenwu. He has always been emphasizing the fact that there is a lot of misinformation in the media.
So please don't go on believing everything you see on the new media. Even in the traditional media, we have instances of things that were said that were not factual. But for the fact that control is very minimal worldwide on what you put out to the new media, so a lot of misinformation goes on.
China has been proactive in controlling the spread of the disease. This is coming from Paul Gwaza. He speaks in the same vein with Sulaiman Mohammed, an alumnus of China-Africa Studies.
Nigeria stands with the People's Republic of China and indeed the people of China in this moment, and believe that China has the capacity not only to protect the residents and humanity in China, but the fact that they have the capacity to ensure that the scourge does not spread to affect other people across the world.
The China Alumni Association at this point recognizes and commends your outstanding efforts at these difficult times. This epidemic has provided China a singular opportunity to show the world its own capabilities, resolve, and effectiveness in dealing with the challenges of the 21st century.
And still taking reactions, Professor Zoeka has a wording. The coronavirus should not slow down our relationship with China.
We continue to pray that the government, because they have shown commitment and resilience towards tackling this challenge by investing heavily on tackling the disease. And we have seen the steps taken so far to contain it, not allow it to spread to other parts of the world. I think that's something that is commendable, and that is also something that shows that the Chinese people are also concerned about not allowing any other part of the world to have contact with this, deadly virus.
And that's where we end this special edition of the program, What You Need to Know About Coronavirus, Nigeria and Nigerians, regarding the current outbreak of the disease COVID-19 that was first reported from Wuhan, China, on 31st December 2019. Clearview TV gathered reliably that apart from efforts of the Chinese government, the World Health Organization is working closely with global experts, governments, and partners to rapidly expand scientific knowledge on this new virus, to track the spread and virulence of the virus, and to provide advice to countries and individuals on measures to protect health and prevent the spread of this outbreak. I am Odion Bello. Bye for now.